Yes. And I think I don't need any formal introduction, right? So I begin. Uh, Basically, like this, I am going to do two things. One is case presentation, and another is that paper presentation. The paper which we presented in that health psychology conference. Uh, it was the eighth International Conference of Health Psychology, Academy of Health Psychology. So first, I will present this paper. Now, actually, it is not paper presentation, case presentation. It's not a case presentation, but it's something else. Something else. I mean, it is a feedback and then couple of other feedback. So feedback in the area of examination anxiety given by some students who earlier participated in my workshop, and they had a few post workshop sessions. So it is basically to convey the way in which I have been doing hypnotherapy. I think I have been doing it not as a therapy, but I have been doing it as a tool for self development, you can say, or like for me, it is a social movement where people learn it and practice it and keep growing. Individuals grow, and that's how the society will start contributing to the goal, to the growth of the society. So it is like that I have been practicing, not as a therapist, but as a trainer, mostly. So to convey that in a little different way, I thought of presenting these things to you. So let me begin with the first thing. And that is about a case of examination anxiety with whom I worked, and the feedback which I received from her, and then onward. Uh, we have a Samatvam Parivar, the people who participate in the workshop. They join that Samatvam Parivar. So it is that social movement about which I am talking. So I started this workshop. As you all know, I learned hypnotherapy in 82 and then started practicing with individual clients from 83, initially with students and then gradually the different other issues. But then in first 5 to 7 years of my practice, I found that with most of the clients, I used to do many things uh, in the same way. Like I used to explain to everyone what is conscious and subconscious in the way in which I did with you. I used to explain about stress and stress management. I used to explain about ego and ego strengthening, and later on ego purification. So lot of things I used to do the same with every client. So gradually I thought that why not to create a workshop so that I can give it to the group of people. So everybody's time and money and everything is saved. Efforts are saved. So that's how I started workshop somewhere in 94, 93, 94. Initially with MS University Health Center, where we started Marg Counseling Center, a counseling center of the university. There I started. Initially, students used to come, and then other professionals started joining it. So that workshop was 12 hours to begin with, and then it kept on expanding, and it reached to 30, 35 hours or so by now. Now, this workshop, which I used to conduct with various organizations, also corporate offices or industries like Reliance and many other corporate, and also I used to conduct with some schools for their teachers, and in our Samatvam also every month. So, um, and after like almost 80% of the clients, they have come with any issue, maybe psychological or biological or developmental issue. Uh, 80% of the clients, after having two, three one-to-one session, they used to participate in this workshop. So over a period of these last 30 years, I think more than 50,000 people have been trained in this through this workshop, through various organizations. So Shreya was one of them. So Shreya, who is a physiotherapist, participated in transformation. And then like this, what I am writing is a newsletter which we used to publish every like quarterly newsletter of Samatvam Parivar. The group of people who did my workshop, they used to join a group. We call it Samatvam Parivar. It's a and it became a social activity for me. So I used to meet them every month, and we used to publish this also a newsletter. So this is a part of that newsletter. I'm writing to the members of Samatvam Parivar that Shreya uh, um, participated in the workshop, and then she took a couple of personal sessions for the performance anxiety which she had, especially performance in examination, before she married and went to USA. She took her license exam as a physical therapist last year successfully, and she shared her feedback for Samatvam Parivar friends. I feel it will be of use to many students if I give the entire process of her struggle and use of different techniques and final outcome as our dialogue which took place through mail during last year. So this I wrote in 2013. One of the issues of Samatvam Setu, we used to call Samatvam Setu, this newsletter. And this event took place in 2012. So Shreya wrote me, this was her first mail after going to US. I had attended your workshop last year, means in 2012, so that I could work on a specific goal of preparing and appearing for exam with healthy mind and body. I had performance anxiety, that is what she is writing. Presently, I am in USA preparing for exam for physical therapy license. I regularly listen to the CD for SIC. I used to record on CD and give to the client their personal session on sensory imagery conditioning, which you prepared for me. I am also practicing Omkar and Pranayama. So these are the things which you used to practice. But somehow I feel uncomfortable and doubtful about my preparation and performance. My main concern is the uncomfortable feeling which I feel is bothering me the most and the cause of my anxiety, that uncomfortable feeling. I wanted your suggestion for the same, sir. And then this was my reply. I understand that your uncomfortable feeling is the main cause of your anxiety. I believe that the insistence for outcome which you desire is the reason for your uncomfortable feeling. The following auto-suggestion and even conscious attempts to accept this universal fact can help you. So, the in the beginning, after the client has said whatever the client wanted to say, we need to acknowledge. This is acknowledgement that yes, I understood what you want to say. So this is I understand that your uncomfortable feeling is the main cause of your anxiety. And then I am giving um, my understanding about her that problem. And then I created a suggestion for her and given it. Now, this is what they already have learned in transformation program. Before I go further, let me tell you what I take in that transformation workshop, which, as I told you, most of the participants, most of the clients coming to me used to participate in. The entire workshop, which is of about 35 hours now, transformation course, we can say, or workshop, I used to teach several theoretical concepts, which included regarding human mind, regarding belief, how they are created and all, empowering, disempowering, stress and stress management, hypnosis, some basic idea about hypnosis, what it is, not what it is, ego and superego, and then ego strengthening, ego purification, irrational beliefs. I used to discuss earlier, there used to be those 10 beliefs given by Albert Ellis, irrational beliefs. So I used to discuss it by giving examples, all the 10 beliefs. And then I used to describe a that mind, brain, body communication, a neurological perspective, Panchakosha, and based on that, exploration of subconscious or introspection. And I used to talk on life is a sadhana, it's a pilgrimage for growth. So these were the theory topics included in 35 hours course. And there are several techniques which I teach to the group, starting with breathing awareness, then PMR and ultradian rest also, mini naps, self-hypnosis. They all were trained in almost in every session of 2 hours. They undergo some or the other 15, 20 minutes of guided session. Then how to create goal for mind programming using auto suggestion, concentration technique, this ECCTTF, or deleting the old beliefs by that permanence, pervasiveness, personal, and then converting have to into want to, sensory imagery conditioning, personal symbol, dynamic imagination, introspection, and Omkar. All these I used to teach in those 35 hours. And used to tell them that they are supposed to practice. I used to give them schedule how to practice everything regularly. And if they have break in their practice, which happens with many people, then I used to teach them a technique called now is the right time. They need to think that, okay, today I remembered, though I have not done it in past week or past month, but let me start doing it now because today is the right time. As I remembered it today, let me begin. So that is how they restart it. And I used to tell them that when you restart, without having guilt, without putting blame on yourself, self blame that I am like this only, or without giving self excuses because of this thing I could not do. So these two patterns are to be erased. Most of the time when we are not able to do consistently something, we have some excuses for not doing it, or we start putting blame on us. So I used to tell them that instead you think that today is the right time, let me begin. So start it. And that is how many, many people have given me feedback that they then are able to consistently practice it. So these are the things which I teach in that transformation program. So now we go further with this case. So I suggested this suggestion to Shreya that day by day I am realizing and accepting that I am supposed to work at my best for fulfillment of my desire. If my desire is in harmony with the design of the universe, it will certainly be realized. So, as each day is passing, with a very calm and relaxed mind, with very comfortable state of my body and mind, I am preparing for my exam. I am utilizing my body, mind, intellect, time, resources, and opportunity at my level best. I know, I know for sure that the result of my efforts will be as per the design of the universe. Whatever is my role, hmm, my niyat karma, it is called niyat karma or the mission of my life, the purpose of my life, I will be reaching there. I feel more and more confident, more and more comfortable day by day, concentrating on my efforts, focusing on what is to be done, and doing that at my best. So, this is the kind of auto suggestion which I asked her to practice. Use this auto suggestion twice in a day while you are relaxing your body or doing trance. That is what I conveyed. The entire session can be of just 5 minutes. And 5 to 10 minutes, whatever, but it can be done within 5 minutes, just relaxing and then having the suggestion and terminating. Kindly write me after a couple of weeks. That is what I suggested. But within 4 days, I received a mail from her. I have started working on specific auto suggestion given by you. I don't know the reason, but I'm very uncomfortable these days. I am all alone at home whole day and my appetite I'm alone whole day at my home and my appetite and sleep are disturbed. I don't really enjoy as I used to before. It's like a lot of friction in my mind. I am engaged whole day with my mind struggling it to be suggesting it to be strong and things will be fine soon. This is what I keep on thinking every day, a whole day. I want to be chilled out like others. I don't know whether this is homesickness or anything else, but because of me, my parents, my husband are getting disturbed. According to their suggestion, I should come to India for some time so that I will be fresh. I don't know, sir, what should I do at this time? If I come to India, then I feel that would be a sign of my not being strong. I am concerned what others will talk about me. What others will talk about me. I really feel bad thinking that I cannot deal with problem same way as others do. I realize this state of mind is not right for me. I don't understand what is right for me at this stage. So, this it is all others are able to deal with their problems, but I am not able to do that personal. Okay. Then I wrote only 2 lines in the reply that it is not that everybody deals with their problem in any different way than what you are doing. Everybody is struggling and they are facing problems and they also find it hard sometimes. This kind of help is required by many, and there is nothing unusual or nothing bad in it. So these 2 lines I wrote, and then after 4 days, she is writing me, I have made a few short-term plans for myself, which I would like to share with you. I have decided to stay here in USA, and I have postponed my license exam to month of October. So I'll be taking exam after a few months. I'll be reading around 5 pages per day so that I can prepare and work consistently towards my goal with relaxed mind. I have also joined him here and have made my schedule a bit busy. And at the same time, I am going to continue working on SIC and Omkar, dynamic imagery of butterfly, and breathing awareness. So these are the 4 things which we continued practicing. This is my short-term plan for now. I will keep you updated with my progress and new upcomings. So then I replied, very good. I am very happy with your short-term plan leading to your long-term goal. It is good to work at your pace and be satisfied of your preparation and then take the exam. Only thing is to continue preparing your mind also by the use of different techniques which you narrated, which you mentioned, to take the exam in October with absolute confidence. So I accepted her decision of dropping out of the exam. Then in November, after taking the exam and getting the results, she's writing me in November, I wanted to share good news with you. With the God's grace and with help of your guidance, I successfully cleared my NPT exam on the first attempt. This exam is considered as one of the toughest exams for physical therapy. The practice of auto suggestions coupled with hard work has helped me to achieve this goal of my life. I want to heartily thank you for your guidance and help. Daily practice of auto suggestions, Omkar, and butterfly image really made it easier for me to prepare and appear for the exam with confident and healthy mind and body. So here I wanted to convey these students who are learning that generally, most therapists believe that dropping out of the exam may lead to tendency of avoidance behavior. And they don't agree with that. Many psychiatrists also, we should not encourage dropping out of the exam. But in my practice, I have used that approach. I believe that at times avoiding imminent stressor and preparing for facing the situation at a comfortable pace along with mental preparation, that is very necessary. Like you drop out and don't work with your mind, and then again next exam, then naturally you will develop that tendency of avoidance behavior. But in that period of time, if you do your mental preparations also as Shreya did, and then taking up the task, that can definitely help. So I many times recommend to drop out immediately and then work in those few months which they get on their mind. Now, incidentally, another physiotherapy student, Mira, also used self-hypnotic techniques for the same qualifying exam at USA and shared her feedback almost at the same time. Like when I received this, almost at the same time, another girl who also shared with me feedback on her training. She is writing that I had difficulty clearing speaking section of TOEFL exam earlier, before she went to USA. TOEFL exam के लिए. I appeared for the exam several times in 1 year, but didn't find any success. This is her feedback given to me later on. I did everything from my side to make this happen, but no luck. Then I came to India and met Dr. Palan to discuss my professional barrier. We did one session of trance where we did sensory imagery conditioning and auto suggestions, and he gave me the recording for the same. I practiced that for about 1.5 months and appeared for my exam, and that was the last successful attempt. Earlier, I did 6 days transformation workshop a few years back, but didn't implement much. After getting a very positive outcome, I practiced other technique of self-hypnosis to clear national board exam in first attempt. I practice auto suggestion. I also practice breathing awareness, concentration technique to improve concentration, ECCTTF technique, PMR to relax before and during exam. With no surprise, I cleared national board exam of physical therapy in first attempt which is a success rate of 25%. I'm very grateful to meet with Dr. Palan and personally believe that all these techniques are very helpful in personal as well as professional life. So by sharing these two feedback with you, my purpose is that hypnotherapy is like giving some tool to the person which one can utilize anytime in the life. Hmm? And it is a self-help kind of therapy. Once you have given the entire capsule, some of the techniques and induction technique and some of the principles, then person can deal with issues in the life by oneself. Incidentally, while I was preparing for this talk, today's talk, like for last couple of days, I was taking out this material and all. One Bhavesh took appointment for his daughter. He told me that he had been to me so many years back. He called me and he is in Africa and now he has come to India and he wanted appointment for his daughter. And what Bhavesh shared with me was also almost the same thing. Yesterday only, it happened yesterday. So I suggested Bhavesh to join this meeting if he is there. Bhavesh, have you joined? Then you may please speak a few words.
Good evening. Yes,
Good evening.
Dr. Palan, I have joined.
Right, please. So you can give your feedback when we met. I remembered Bhavesh, a 10th standard boy, young boy, 10th standard, when he came to me. Please, share.
Yes. Somewhere in, I believe it was January, mid-January, if my memory is correct. In mid-January, I was in the standard 12th, and uh, I met you at that time. I was in really big anxiety about exam, and I was actually almost not ready to take the exam because of, again, similar performance anxiety that there used to be a big, you can say, phobia that the 12th standard 12th science exam is very tough and students don't do very well, and that kind of thing. And I was really in panic. And there was some small clip in Gujarat Samachar newspaper about you are taking helping the student for this thing, and we immediately approached to you, and then we took, I think we did some 3 or 4 sessions before my exam, and I was able to take up the exam, and I passed out the exam. My goal was to become an engineer, but because of my merit, I got admission into BSc. But I continued with you. I was taking your thing because still there was a lot of anxiety again, and there was a future this thing. And during in the BSc, I took one. There was in MS University. There is one program I used to run. There was one exam they used to take to get admission into engineering. There were only 5 seats. They were allowing only 5 people, and I took that exam, and I cleared that exam, and I got admission into engineering. And I was from basically vernacular medium student, and prior to that, there was no vernacular medium student has ever cleared that exam before, and I was able to clear it. I was the first student, and I believe that after my there are many other who has done that, but I was the first time it was happened, and I became an engineer. I have been always using your techniques. It has really helped me throughout my education, at every stage of my education, and I have used for my professional life also. And means I'm really thankful to you. Means it was a life changing thing for me.
Okay, thank you. Thank you, Bhavesh. And Bhavesh took appointment for his daughter, who is of the same age. When I met Bhavesh, he was of that age. And
Yes.
now the daughter is 17 years old now. And good. So thank you very much, Bhavesh, for coming and sharing. Now, if you want to continue being here, I'm going to present something else also. You continue. Thank you.
You're welcome.
So, this is what I wanted to share, and we can have some discussion on it, and then I go on the second paper. If there are some questions or comments or sharing. Some of the therapists who have joined, like Veena is there, Dr. Santanam is there, and some others may be there who are doing similar very good work. Baljeet is there. So you can share some of the things also. For another 5 minutes or so, we can have some discussion. Anybody?
Uh,
Yeah, please, sir.
Sir, actually, the similar type of work I have done, I have taken one or two CBSE students and I measured their study skills. Actually, there are some technique, there are some standardized tests are available
Right.
in order to measure their study skills. Afterwards, I have used all these techniques, actually, especially SIC technique, then that another technique I have used, butterfly technique, all these things. And after that, I have measured their study skill. After actually, I asked them to practice for 10 sessions. After the 10 session, again, I have measured their study skills. Actually, after practicing these techniques, it is significantly improved their study skill. And I presented the same thing in our conference also, in our Baroda conference also. Again, I have presented the same paper in the Meghalaya, this USTM, University of Science and Technology Meghalaya. They organized one conference sponsored by Indian School Psychology Association. There also I presented, and actually well taken by others also, sir. So this is my experience regarding working with the students.
Very nice. That
Yes,
is a very good part of your work, Dr. Santhanam, that you
thank
are
you, sir.
using the objective tools,
Sir,
the,
correct, sir.
the psychological tools for assessment, and that
Correct.
one should do.
Yes,
I
yes, sir.
think that makes it more authentic, and you can it can become evidence based with
Correct,
the kind of
correct,
this
sir.
kind of
Correct,
work.
correct, correct.
Very good. Thank you very much
Yes,
for
thank you, sir.
sharing this.
Thank you, sir. Thank you very much for the opportunity, sir. Thank you,
Welcome.
sir. Thank you.
Welcome. Anybody else has got any question or sharing?
Not a
Fine.
question, sir.
Yeah, please, Veena.
But in my observation, I see that use of hypnotherapy. Hypnotherapy is very effective for dealing with exam anxiety, memory recall, attention focus, concentration. It's very, very effective. I have many students come back and talk about how easy it is to recall answers when they need it, particularly during exams or viva, which is working in their favor.
Right.
So, yes.
Very good. Yes, we all have this kind of experiences, and that's very nice, Veena, for sharing this thing. Good. Thank you for sharing. Avnish also must be having a lot of experience, Baljeet, and all of us. Good.